You can start.
Okay. Hello there. I'm Dr. Salim, one of the doctors in the unit today. May I confirm you are Mrs. Sarah, 28 years old?
Yes, doctor.
Okay. How may I address you during the meeting today?
You can call me Sarah.
Okay. So, Sarah, I am here to ask some questions regarding your current medical condition. And after that, I would like to examine you. Is that okay with you?
Sure, doctor.
Okay. Sarah, can you tell me what brought you into the clinic today?
Yes, doctor. I'm having this throwing up for last 3 days, and it's not settling despite taking medicine by prescribed by GP. So I'm here today to take your help today.
Okay. I'm really sorry to hear that, but I will do my best to sort it out and guide you accordingly. So, do you have any other problem besides that?
No, doctor.
Okay, and do you have any long-term medical condition that I should be aware of?
No.
Okay, so let's get back to the your main problem. So, were you completely all right before 3 days?
Yes, doctor. I was completely fine for last before 3 days.
Okay, and is it the first time you are getting this recurrent vomiting?
No, it's a second or third time.
Okay, so in the past, you also have episodes of throwing up.
Yes, doctor. Year before, I visited to travel to with my family to Sri Lanka, and we were having holidays there. And all of a sudden, I started throwing up there, and I got admitted for 5, 7 days there. And after that, they discharged me.
Okay, that
I
was one
got
year
better.
back. Okay,
Yes,
okay, okay. So, how many times now you are getting, you are throwing up in a day now?
it's almost every 30 minutes, and it stayed with me to 3 to 4 hours, and without any break. I'm unable to swallow anything, but I'm getting well in between.
In between you are well, okay. And have
Okay.
you noticed any phlegm or food particles mixed in the this when you throw up?
No, no,
Okay. Does it contain any blood?
no.
Hmm. And how did it come on? Was it sudden or gradual onset?
It's all of sudden, doctor.
It's all of the sudden, okay. And what makes it worse? Any food, any particular kind of food, or anything other any else that makes it worse?
No, I didn't notice.
And anything makes it better?
No,
Okay. Do you have any feeling of sickness or I mean nausea before this throwing up?
no,
Hmm. And do you have any yellowness in your eyes along with this?
no,
Any acidic taste in your mouth?
no,
Any difficulty in swallowing?
no.
Okay. Any tummy pain or tummy discomfort?
Yes, I do have tummy pain, but it's very mild. It's not bothering me a lot. But at the time of this throwing up, I feel tummy pain.
Okay. And any tummy swelling?
No,
Hmm. Okay. And do you have any problem in your water works? Any changes in your frequency of water? Oh, sorry, in your bowel works? Any changes in the frequency?
no.
Okay, they are fine.
They are fine.
Okay. Any okay. Have you ever noticed any worms in your bowel works?
No,
Okay. And any changes in your diet since this problem started?
no, doctor. I'm eating at home. I'm fine. I didn't
Okay.
travel anywhere
Hmm.
since many
Oh,
months.
hmm. Okay. You didn't travel anywhere between this before this problem, right?
No, no,
Hmm. Okay. Any do you have any complaint of high body temperature?
no,
Any feeling of tiredness?
no,
Any weight changes?
no,
Any lumps and bumps in your body?
no.
Okay. And did this throwing up, have you noticed that it occurs at any particular time of the day or it occurs throughout the day with episodes?
Uh, there is no particular time, but last night, what I feel that at 3 4 a.m. All of a sudden I woke up from sleep and I have started throwing up. Uh, Otherwise,
Mm,
no specific time. But yesterday I started it at night also.
started at night. Okay. Do you have any feeling of early fullness after meals?
No,
Mm, okay. And okay, do you have any mood problems?
no.
Okay. Any complaint of headache?
Yes, I do have headache along with the throwing up.
For how many days?
Similar duration, doctor.
Similar duration. So your headache was sudden in onset.
Yes, it's not too severe that can I can mention that's bothering me a lot. But my main
Mhm.
problem is throwing up
Okay, okay. So can I ask where exactly you are feeling headache in what area?
all over.
All over, okay. And if I tell you to grade it from 0 to 10, 0 being the minimum and 10 being the maximum, how would you grade it?
It's 5 by 10, doctor, or 6 maximum.
Okay, and does it increase with coughing, sneezing, and bending forward?
No,
Okay, and anything which makes it relief, any painkillers or any other medication?
no,
Okay. Do you feel any dizziness after standing from sitting position?
no,
Okay. And okay, do you have any complaint of high blood pressure, high body temperature, or any other significant illness?
no,
Okay. Any allergy to any particular medications?
no.
And are you taking any medicines? Can you show me the list of the medications you are taking?
Yeah. This is you can see it's ibuprofen, and this is prochlorperazine, chlorperazine for vomiting, and nothing. Metoclopramide.
Mm. Okay. Okay. And okay, do you have any history of hospitalization in the past?
Yes,
May I ask when
last
and
year.
last year and why? Because of the
At,
same
at, yes, at Sri Lanka with the similar condition.
with the similar condition. Okay, and but it was resolved after you were hospitalized and you were given medications, right?
Yes, they did a lot of investigation and did a scans and give him medicine. And after a couple of days, I got well. But in between, I had this episode, but I didn't go to hospital at all. And this time, it's seems like too much now. I cannot tolerate anything I swallow. I throw up
Mm. Okay, so in between when you had this episode, how did it resolve
by itself.
by itself? Okay, okay, and do you have any family history of similar medical condition or any other particular significant illness?
Yes, my mother is having diabetes, hypertension, and my father having high cholesterol and ischemic heart disease. And my brother is having migraine, and my sister is having some thyroid issues.
Mm. Okay, and okay. Do you have any problem of anxiety or decreased sleep?
No, doctor, my life is fine. Everything is okay. I'm a university student. I'm attending my classes regularly, and
Mhm.
nothing.
Okay, so may I ask you some personal question, if you don't mind? Do you smoke
No, doctor.
and do you take alcohol?
No,
Okay, and any birth control pills? Sorry to ask, you are taking
no,
any problem with your periods?
no.
Okay, um, and do you drive?
Yes, I do drive.
Okay, and is this condition affecting your daily life and your studies?
Of course, doctor, I'm missing my, classes nowadays. I cannot go outside. I
Mm.
kept myself alone because of this social issues. I feel very embarrassed in front of other when I'm throwing up hours and hours and nothing is helping me.
Okay, I'm very sorry to hear that, but I will sort it out and guide you accordingly. So, can I examine you, Mrs. Sarah?
Yes, you can examine me.
Mm.
What
Okay,
do you
so
want to see, doctor? Zena?
first I want to know the vitals of the patient.
Vital blood pressure is 100 by 60, and you can see patient is mild dehydrated.
100
Otherwise,
by 60.
GCS is 15. Yes, GCS is 15 by 15. Patient is
Mm.
afebrile. Pulse is
Mm.
100 beats per minute.
And it's regular pulse.
Pulse is regular, yes.
Any postural drop in the blood pressure?
No postal drop.
Mm. Okay, and now I would like to check the hands of the patient. Any tremors, any sweating, any nail
No,
changes going on?
no,
Mm. Okay, and any is there any proximal myopathy?
no,
Okay, in the eyes, I want to check for anemia and jaundice.
no anemia, no jaundice.
No anemia, no jaundice. Okay, and any ulcers in the mouth or any pigmentation?
No ulcers, no pigmentation.
Right. Ms. Sarah, at this point, I would like to ask if you have any complaint of rash, spot pigmentation in your body.
No.
Okay. Okay. Now I would like to check for the thyroid.
Thyroid is normal.
Normal. Okay. And then I will go to the abdomen examination. First, I want to do inspection. Is it normal or distended or
Normal.
inspection? Okay. Any then I would like to palpate superficial palpation, and if there is any tenderness or it's soft legs abdomen.
No, no tenderness, no guarding, no rigidity.
And on deep palpation, any visceromegaly,
No visceromegaly.
bowel sounds audible.
Audible, audible.
Okay. Any pedal edema.
No pedal edema.
Okay. How many time I have left?
You have 2 minutes, 10 seconds left.
Hmm. Okay. Mrs. Sarah, I just want to ask some more questions. Are you sexually active?
Yes, doctor, I have a regular partner.
Okay. And any casual partners you have?
No,
No. Okay. Okay. And any chances of pregnancy right now?
no.
Okay. Sarah, what are your
2 minutes left.
concerns? What are your concerns?
Yes, doctor, what's going on with me? Why I am throwing up for last 3 days now?
Yes. After taking history and after examining you,
Yes, yes, doctor, my concern is what's going on with me.
Okay, so Sarah, after taking history and after examining you, I have certain possibilities in my mind. But for this, I want to admit you in the hospital for a short period of time, and I would like to run some investigations and scans. And after that, I would be able to um, guide you accurately. Is that okay with you?
Yes, doctor, is that this condition is curable?
Um, At this point, I cannot say for sure, but most likely it is a curable condition as you do not have any as you do not have any alarming symptoms along with this. So most probably it
Mhm.
is a curable condition. Um, however, I would be able to say it more accurately after the diagnosis is confirmed. Is that okay with you?
Yes, doctor, I'm really worried about that because many years I'm suffering with this condition. Do you think maybe I have cancer in my body somewhere?
Sarah, because you don't have any alarming symptoms, yeah, like you do not have any weight loss, and um, your headache is also not fitting in that category. You have a mild to moderate headache, and it's not like the usual headache which we see in brain tumors or cancers. And also you don't have any other features, like you don't have any fatigue, any complaint of tiredness, and you don't have any significant weight loss. So most probably it's not the cancer. Are you getting me?
Yes, yes, doctor. Okay, doctor. Time up.
Mhm.
So you have time if you want to summarize up your case, and you can then present your case. You have 60 seconds to present your case. Give me your positive findings.
Okay. She is a 28-year-old Mrs. Sara, university student, and she has complained of recurrent episodes of vomiting since 3 days, along with mild to moderate headache, and mild tummy pain. Uh, she also has similar episodes in the past, and during which she was also admitted once in the hospital, and in between she also has these episodes which were resolved by itself. So this is regarding the history. On examination, she is a young female, and she looks dehydrated with a blood pressure of 100 by 60 and pulse of 100 beats per minute. um, uh, Apart from the dehydration, there is no significant positive findings. There is no anemia, jaundice, and um, any other significant finding in the general physical examination, and abdominal examination is also unremarkable.
Okay. So, what's your differential diagnosis?
Yes, my first differential would be cyclical vomiting syndrome.
Okay.
Mm. And yes, cyclical vomiting syndrome. Other could be migraine, but it's not fitting the criteria. Her headache, she has headache with vomiting, but it's not fitting the criteria of migraine. Um,
Okay.
mm. And yes, these two are the differentials as far as I can understand from the history.
Okay.
Mm.
So, how you will investigate this case?
So, before labeling this cyclical vomiting syndrome, I will do all the routine in blood investigations. I will do CBC to look for anemia and all the electrolytes to see if there is any electrolyte abnormality, renal function test. And I will, in the specific investigations, I want to do ESR, CRP to rule out any inflammatory markers, and scan ultrasound abdomen, and also CT scan of the abdomen to rule out any uh, yes, to rule out any significant condition before labeling it as a cyclical vomiting syndrome. Also, I would like to do MRI of the brain since she's complaining of the headache. So I would also like to do
Mhm.
MRI brain.
Okay. Anything else you want to add in this investigations?
Um, just this, just this.
She is a she is a
Sorry,
female.
what? Yes,
She is a female.
yes, beta HCG to rule out pregnancy,
Okay.
and what
Okay.
else? An
Would you
ultrasound
like to add?
abdomen, ultrasound abdomen and pelvis, and beta HCG.
Okay. You have mentioned already ultrasound abdomen.
Mhm.
And what about the serum cortisol, ACTH level, and thyroid profile? Would you like to add in this?
Yes, I would like to do, but she don't have any symptoms such which are suggestive of Addison's disease or
Hmm.
Cushing syndrome, and
Hmm.
also she don't have any findings which are suggestive of hyper or hypothyroidism.
What about blood glucose levels? Do you think she's suffering from decay?
I asked regarding the abdominal pain, but she said there is vague abdominal pain. And I
Hmm.
also asked about high blood sugar in the past medical history. Uh,
Hmm.
so she said there is nothing, anything like high blood sugar.
Hmm. Okay.
But still, in
So
the differences of recurrent vomiting, we can keep DKA and Addisonian crisis, but there is nothing pointing towards it.
okay. So would you like to do or not? Glucose level, you will check.
Yes, in the baseline investigations, I will check. Mm.
That's great. Okay. So how you're going to manage this case?
After like all these investigations, if all the investigations are normal, then I will do the general management, which will include the education and counseling of the patient regarding the condition, and I will involve the multiple disciplinary team, the which will include the gastroenterologist, the um, gastroenterologist, psychologist, and specialized nurse. And then,
Mhm.
yes, this would be regarding the general management. Regarding the specific management, as she is dehydrated, so I would like to give her IV fluids and
Mhm.
yes, and some analgesics for her headache and for her tummy pain and antiemetics.
Mhm.
Yes, this.
Okay. What about nutritional support?
Nutritional support, yes, I can involve dietitian also for that. And yes, I can involve dietitian for nutrition support. However, she said her diet is almost normal, and she don't have any problem with the appetite.
Mhm. Okay. So do you want to add anything else?
No, just this.
Oh, so that's wonderful, Dr. Zainab. Your, history taking format is excellent. But the problem which we are facing as a candidate, always a same problem with all, not with you.
Mm,
It's a differential diagnosis always. Okay.
yes.
We become very biased when we have some clues to related to other system, and we are getting forgetting most of the time the basic symptom which system is involved. So
Mm,
let's repeat your differential diagnosis, otherwise everything is fine and we will discuss your case in detail from the starting.
okay.
Do you want to add anything else in this differential diagnosis?
Um, uh, l- After like this, after you give me hints, I can keep this DK and Addisonian crisis, but still, I would keep it down the list because I cannot see any clues in the history. But
Hmm.
if we are considering the DDs of recurrent vomiting, then we can keep it down the list.
Okay.
Mm.
So again, I'm giving you last chance and last few seconds if you want to add any differential diagnosis.
Mm.
Otherwise, I will deduct your differential diagnosis marks and patient welfare also. Why welfare? I will tell you later on. Otherwise,
Okay.
you're going to lose this mark.
Mm.
Okay, fine. So
Like,
let's start.
okay, you go on.
No, no, no. Please carry on. If you want to add, if you want to say something, please.
Just I want to add these two only, DKA and Addisonian crisis. Otherwise, it's the same.
Okay,
Mm.
okay. Thank you so much, Dr. Zainab. That's a wonderful performance, and your differential diagnoses are good. But I need to add few things in your presentation and your performance. Otherwise, everything was perfect. You
Mm.
did cover everything, but few system and few differential diagnoses need to ask in this case. Your introduction was very nice. So you come to the station and you introduce yourself. Hello, my name is Dr. Zain. I'm one of the doctor today here. Okay. Am I talking with Sarah? Then you set an agenda. We are here to discuss with you about your health condition. Is that okay with you? And you forget to mention, I think, few things that we are here to discuss with you about your health condition. And during my consultation, I will take a few notes that will remain confidential. And after that, I will examine you. Is that okay with you? That's a very important thing. You are missing, I think, second time. Okay.
I usually I
This will
don't
give
mention this that I would take some notes because, just because to save
no,
some
no,
time.
not save time because you if you add this confidentiality, then you will
Mm.
get a mark.
Okay.
Okay. Yes, you will get an extra mark. And in
Mhm.
you are not thinking about this, but it's a you will keep the patient's information in confidence, right?
Mm.
In communication, what we are doing when we are talking with the relatives, we are always mentioning there, always there is nothing written there. Be sure that your father is aware of today's meeting. Why?
Mm.
Because
Yes,
it's
please.
the patient. Yes,
Mm.
personal information. So
Yes.
this is very important point actually in the beginning. You can add this in your scheme, and that will give you extra mark. Okay. After
Okay.
agenda, you come to the that this sympathy empathy. That's very wonderful. This must be a difficult time for you. I will try my best to sort it out and help you accordingly. Then coming to the point, can you tell me more about your vomiting? Surrogate give you the history that I have a 3 days history, and then coming to the forward that I have a lot of episodes in between. I'm getting better. Then sympathy, empathy, and ODPARA. Onset, duration, progression, aggravating, relieving factor, and associated symptoms. But one thing was missing in ODPARA. I do always you know ask the students, when there is some pattern of the disease, please do add second P here. P for progression, P for pattern. Describe the
Mm.
pattern of any symptom like joint pains, vomiting, headache, and palpitations, whatever. There is a tremors. So you can add a pattern. Pattern, how can you define the pattern here? You did ask a few questions about the frequency. You forget to about the mention about the amount of a vomiting. What is the quantity of these vomits?
Mm.
Then color,
Yes.
consistency, timing. Timing you did ask at 5 minutes 30 seconds. So this is a
Mm.
pattern. Pattern must be asked immediately in between the odipara.
Mm.
So facts, frequency, amount, color, consistency, timing, and smell. Okay, this will give you a lot of clues. If there is any obstruction of stomach outlet, if there is obstruction of any small bowel, then that will give you a clue. Okay, here.
Yes.
Then
Okay.
coming to the associate local, you did very well. You started from the mouth, oral cavity, and then you have any soreness, any throat problem, any burning sensation in the chest, any tummy pain. Then you did ask about the any yellowness in your eyes, your hard stool, loose stools, okay, any pressure of the in your left or right side of the tummy, any organomegaly.
Mm.
Then you ask about everything related to vomiting, related to GIT system. Then coming to the kidneys, you need to ask about uh, burning soreness in your urine and soreness in your waterworks, or any heaviness in your tummy, any problem with your waterworks, especially blood. So you need to rule out what acute glomerulonephritis or UTI, okay,
Mm.
because it can cause also vomiting. So
Yes.
causes. These are the causes related to the GIT system. Then extra GIT causes. It's a very simple to remember, very easy to remember. A, B, C, D, E, F, G, H, I. I'm going to share with you this slide. So how to approach this case, actually vomiting. This is general symptoms, always difficult to approach, always. It's not with
Mm.
you, not with me, with every candidate. We are not, trained in this setup. We are not trained in this, design. We are ignoring these symptoms always. So coming to the next, when you finish your associated local, associated general symptoms, Then these wafers, general symptoms, weight loss, anorexia, fever, fatigue, itching, rash, racing in the heart, sleep, sweat, and snore. Then coming to the palm force hug, you did ask about the social history, smoking, alcohol, job, impact on job, driving. Why you didn't stop me from the driving here?
Because she was just having vomiting. I at that time I think that should I stop or not? Then I thought it's vomiting only, so I should not stop
If you are
in case
putting
of
your
vomiting.
diagnosis, if you are putting your differential diagnosis top of the list, CVS, cyclic vomiting syndrome, you need to
Mm.
stop. You ask him, you should ask him, please inform DVLA. Okay?
Okay. Mm.
Yes. Just counter check it and let me know when you
Mm.
just checked it out and let me know. Then living and traveling, you were not bothering towards that traveling history, but I'd give you the history to give a clue that there is no traveling history recent and didn't take any
Mm.
food from outside. So
Mm.
coming to then the general symptoms, family history, you did ask. I mentioned that there is a family history of migraine. That is very important history actually.
Mm.
Of migraine, family history of migraine is very relevant in this case. Why? Cyclic vomiting syndrome. You are very right. This the first differential in my history. Today's case was CVS, cyclic vomiting syndrome. So always take a migraine history. Family history is very important. This was the clue in here. Then headache. You did very well. And then examination scheme was lot of things were missing. Okay,
Mm.
why was missing? I
Okay.
don't know. Uh, then coming to the differential diagnosis after examination, concerns were good, mashallah. So
Mm.
you uh, replied very well, but need to do something that I highly appreciate your concern, Ms. Sarah. There are few things in my mind. It might be just mention over here to the examiner that you're thinking about that. That might be related to your tummy. That might be related to your head, and or sometimes there is some problem with the glands. Okay, if you are thinking about the Edison, thyroid
Mm.
or diabetes, so you need to mention in this direction, so should give an idea to the examiner that you are keeping all the differential diagnosis in your mind. So there are few possibilities in my mind at the moment that might be some gland problem, some your tummy problem or bowel problem, or in problem with the your head. So it's very early, but I need what I need to do. We are going to admit you, or we are planning to run some blood test and scans of your body. Once the result will be available, I will be in better position to discuss about that. Okay. Do you have any other
Mm.
concern? Is the doctor, is that a curable condition? It is very early to say it's a curable not, but this your symptom can be controlled. Simple. No need to give
Mm.
a lot of details when you're dealing with the concern. Why? Because there are three, four concerns, and you have 1 minute or 1.5 minutes. So you need to pick up those marks 100%.
Okay.
You need to address the concerns. No need to give the details here. Small,
Mm.
small my bites give to the surrogate. So give an idea to the examiner that you know how to deal with the concerns. And is it a
Okay.
cancer? Very nice. You did very well. It's very early to say, Miss Sarah, but based on your history and examination, it's less likely. But still, I will run some blood test and scan of your body, and will inform you accordingly. Okay. That might be a, because in medicine everything is possible. But you have mentioned based on your history and my examination, it seems less likely that you have a cancer, but still there is a possibility. We will run blood tests and scans of your body. Okay.
Mm. Okay.
Okay. So investigation, coming to the differential diagnosis, sorry, coming to the differential diagnosis, Dr. Zainab,
Yes.
keep this word in mind, and every candidate, please, when you are dealing with the specific symptoms related to some specific system, please do put your differential diagnosis first of all of those system. So what are the differential diagnosis here? Must be first of all, you should say it might be a simple gastritis, doctor.
Mm.
It's involved the GIT system. Am I right or not, Dr. Zainab?
Yes. Yes.
Yes. So be simple. It might be a simple gastritis. It might be a GERD. Okay. So as the patient is indeed having a headache, so I will keep my differential diagnosis migraine also along with the CVS, this cyclic vomiting syndrome. It might be a
Mm.
IBD, but however, I didn't find anything in history, but I will keep my differential diagnosis. Okay,
Okay.
I would like to do the beta HCG as she is a female, so I will rule out the pregnancy also, and I will check the blood sugar if there is any indication. So gastritis GERD must be at the top.
Okay.
If then surrogate will probe you. So what do you think, what may be in this patient? So patient is having vomiting and headache, what's your top differential? Then surrogate will, examiner will give you a pathway to run and give you the final diagnosis. Then you will say, add here, doctor, based on these findings and my examination, I will put the cyclic vomiting syndrome at the top, then down the list, but I would like to rule out others. Why? Because this is a PACES exam. PACES exam, always you cannot pinpoint a single diagnosis. It's a
Hmm.
exam of differential diagnosis. You need to put three, four differential diagnosis. You can check any, answer sheet of mark sheet of PACES exam. There is a specific marks of the differential diagnosis, and many candidates are unable to pass their PACES exam because of this differential diagnosis. Why? Because we have very narrow differential diagnosis in our mind.
Hmm.
Make a habit. I think you are going to appear in exam in coming,
Yes.
right? Right?
Yes. Yes.
Yes. So
Inshallah.
differential diagnosis, you must at least three or four, and that system you must touch first. That system, which is vomiting related to which system? GIT system. So gastritis at the
Hmm.
top.
Okay.
Okay, that's very wonderful. Then investigation, you did very well. But when are you are dealing with the vomiting, please check pregnancy, blood sugar,
Hmm.
and cortisol
Hmm.
level to rule out the Addison disease, because this is a
Okay.
favorite topic of PACES. Just a minute. So can you see this slide
Yes.
visible to you, right?
Yes. Yes.
So
I
when
can
you are
see.
dealing with the vomiting, so coming to the after introduction, OD para, I highlighted this, P red color. Why? This is a pattern. What is the pattern? This frequency, amount, color, consistency, time, and smell. That's a very important question over here. After finishing this, coming to the local symptom first. Local system, GIT, starting from the mouth till rectum, each and everything is a GIT. Soreness in your mouth, throat pain, burning sensation in the chest, tummy pain, yellowness of your eyes, then left and right hypochondral pain, diarrhea, loose stools, hard stools, not a constipation, hard stools. Okay, any blood in your stools, or any blood in your vomit, hematomesis and melena. Okay, these questions are related to the local GIT. Then coming to the associated journal, your differential diagnosis. Non-GI causes, look at here. You can remember non-GI causes always A, B, C, D, E, F, G, H, I. Addison, B from brain diseases like cyclic vomiting syndrome, raised ICP, and migraine. C for cardiac,
Hmm.
MI, D for DK, E for ENT causes. Someone candidate was mentioning during our case, it might be some labyrinth disorders or some ear problem. He is absolutely right. And then
Hmm.
for foreign materials means alcohol. Okay, cocaine, some foreign material you are taking, if extra, cannabis, party drugs. So G for gravida pregnancy, you need to rule out. Hypercalcemia is a one of the cause of vomiting. I for infection, sepsis, it can cause also vomiting. So
Hmm.
examination, coming to the examination scheme, look, hands, pulse, uh, proximal myopathy, lymph node, thyroid, and I have forget to mention postal drop over here with the pulse.
Hmm.
I for fundoscopy, need to check the
Yes.
H-shape movements when you're dealing with the vomiting. If you're
Hmm.
especially keeping your differential diagnosis at the top inside the brain. So you need to
Yes.
check eyes, H-shape movement, and you must offer fundoscopy to the examiner. Sir, I would like to do the fundoscopy. Pronated drift is mandatory, auscultation of the lungs and heart, GIT, liver, spleen, mass, and edema.
Hmm.
So you can see from in this list which is missing, which should not be missing in your real exam if you will have this case in your PACES case, exam. So what is cyclic vomiting syndrome? Can you tell me something about that?
Yes, it's a chronic functional condition with recurrent episodes of vomiting with vomiting free periods in between. And
Very nice.
hmm, usually it's there are four phases: inter-episodic, prodrome, vomiting, and recovery phase.
Very nice.
So,
This is a Rome
yeah.
4 criteria also for
Hmm,
diagnosis.
hmm.
And this
And
acute onset
usually
duration less than 7 days.
it is associated with family history of migraine. There is an
Very nice.
association.
And what are the triggers?
Um,
Same like migraine.
Same like migraine. Okay.
Yes. So
Any
Rome 4 criteria for,
like migraine triggers any dietary changes or sleep deprivation or any
yes,
particular kinds of food.
you're right. You're absolutely right. So there is a Rome 4 criteria to diagnose this CVS, cyclic vomiting syndrome, acute onset
Mm,
of less than 7 days,
mm,
minimum 3 episodes in the preceding year. Okay. Absence of nausea, vomiting in between the episodes, as mentioned by Dr. Zainab. Then no GI, metabolic, endocrine, or CNS disorders. You have to rule out
mm,
each and everything. Then supportive criteria, history of migraine in the family, more than 4 episodes. Okay. 4 episodes per hour. This is a very typical. I told you that I have many episodes every 30 minutes. I'm having vomiting
mm.
and
Yes,
recurrent
yes,
vomiting. So more than
yes.
4 episodes per hour. It's a typical for this. And timely early morning from 2 to 4 a.m. and 6 to 8 a.m. is the typical time for CVS, and cannot this is not associated with any food intake.
Okay.
Okay, this is associated usually 80% with abdominal pain. Okay, sometimes some patient got laparotomy due to the recurrent abdominal pain and vomiting.
Okay.
Though nausea is the most distressing symptom in CVS. Improve sometimes by switching the light off. TV, lethargy, and headache improves if you switch off the light and switch off the television and just put uh, put off your mobiles. So these are the triggers, same like migraine. Otherwise, management plan, patient education, counseling, family support, nutritional support. This always, Dr. Zaina, please in exam, you do mention nutritional support. Don't give explanation. Patient is eating or not eating. He is having some problem with the tummy. He is having recurrent vomiting. He must have some electrolyte imbalance. He must have some, his case is vomiting. He's unable to swallow now at the moment. Whatever he is eating, he's throwing up. So
Mm,
his body is deficient of a lot of things. So always do mention nutritional support, social psychological support, and avoid triggers. These are the basic non-pharmacological management. Supportive prophylactic medicines are available for this condition, and there are abortive, same like migraine treatment. Nothing
mm.
else, no need to mention anything else. These are the same almost treatment plan for those conditions. Supportive, sometimes you can give a glucose containing IV fluids. So this was a cyclic vomiting syndrome. And how you feel, Dr. Zainam, about this case?
This is, I think, very rare case. I was trying to
Mhm.
find something positive, but everything was negative in this case.
Everything, just what is the meaning of, what is the purpose of this case to keep here, because everyone knows that DKA, Addison disease, we need to rule out, we need to
Mm,
rule out gastroenteritis, GERD, or IBDs, but we are not usual thinking at that side, migraine, CVS. Just this
mm,
is to highlight, don't forget about these differential diagnosis when you are in exam. Sometimes you can encounter such cases, so you should have in your mind that such cases can be put in differential diagnosis if the patient is complaining of headache and vomiting.
mm,
This is only for exercise purpose. And how to rule out the differential diagnosis, extra GIT causes, so you can remember this mnemonic ABCDEF. And how to examine, scheme of examine in any case of vomiting. you should keep in this sequence. If there is any modification according to the case, that might be possible. If you're dealing with
Mhm.
the DK, if you're dealing with the Addison disease or thyroid, so okay, so you can modify. You can't be strict, Dr. Zainab, in case of examination in PACES exam. You should modify your schemes. You should modify your differential diagnosis according to that
Mhm.
particular patient who is sitting in front of you. You can't
Okay.
be rigid in any case. Especially, you should be
Mhm.
flexible. Okay, keep in your
Okay.
mind one thing. In PACES, there's a no fixed rule. You should modify your schemes and your differential diagnosis according to the case.
Mhm.
What differential diagnosis? In this case, you can put differential diagnosis simple gastritis, GERD. You can put your differential diagnosis cyclic vomiting syndrome, migraine. These are the top four differentials. If examiner is asking you what you will think more than being a female, you will put a pregnancy, and you need to life threatening condition rule out Addison and DKA. This is the mandatory things. Otherwise, your differential diagnosis revolve around the gastritis, peptic ulcer disease, cyclic vomiting syndrome, migraines. So these are
Mhm.
your differential diagnosis.
Okay.
That's wonderful. You are well prepared, Dr. Zainab, I think.
Thank you. Thank you.
But your performance will got affected in driving, especially, and your
Mhm.
differential diagnosis. You can lose
Okay.
marks in
Okay.
exam. Okay. Otherwise, that's
Okay.
wonderful. Everything you have covered.
Okay.
Any question from anyone of our audience?